A husband of a resident who lives at the Kingston healthcare facility is speaking out tonight after his wife tested positive for the COVID-19 virus while at the facility. And he says his greatest fears are coming true. 72-year-old Cheryl Driscoll has been a resident of the Kingston Healthcare Center for the past 6 months, according to her husband, Michael Driscoll. The two have been married for 7 years, and since then, they have never been apart from each other, even when she was admitted to the facility. And out of abundance of caution, Michael would spend hours with her at the center.
Every day for 6 months. I never left, 7 days a week, 10 hours a day. I helped change her. I helped with all the help with her. The nurses appreciated it. And medication issues, over medication on some of the medication. So I would address those issues, and then they got kind of mad at me, social workers did.
Michael says that these were some of the many disturbing practices of the facility that he witnessed. And as the COVID-19 outbreak began, he worried that his wife would soon contract the virus, since she has several underlying health conditions. And he grew more concerned after he says he saw the staff becoming sick.
When the first part of February, the nurses were running 103 temperatures and staying at work. Some of them were there for two weeks. They were coughing all day long. And I used to ask them, "Don't you think you need to go rest?" So I saw a lot of people getting sick.
Michael sadly shares that his wife was diagnosed with COVID just 2 days ago, and she's currently being treated at Memorial Hospital. And she is one of the 5 people hospitalized from the facility.
She's tested positive for COVID-19. It was a shock. And I was concerned because she hadn't been feeling well for 4 or 5 days. She had a sore throat and coughing a little bit, and I was praying that wasn't what it was.
And Ryan Alsop, the county administrative officer, tweeted out that as of Thursday, Kingston Healthcare Center accounted for 86 positive cases in Kern County, including 5 hospitalizations and 7 deaths. The number of deaths making up nearly half the number of total deaths in the county.
I mean, I had a feeling that the nursing homes would come under attack here, but to think about that much death out of one nursing home in our county is just is unbelievable. How did it get in there? I mean, the only people going in there are staff, medical personnel, and we just don't know.
Michael says he understands the concern of not allowing visitors to see their loved ones in these facilities, but doesn't agree with it and deems it unfair to the residents and proposes this solution.
It's a hard call to make. I think the door should be open for visitors, though. Go ahead and check them. You can test them, and if they're not positive, they don't have a fever, I think they should be allowed to go in.
Michael shares that his wife is doing okay for now, but the next few days will play a large role in her recovery.
Nursing homes aren't taking people COVID positive, or at least with a fever, not taking them back. I'm not sure if that's such a great place to go back to. I mean, it's pretty. A lot of people would be afraid to do that with so many deaths happening in one facility.
Michael says that he will continue to shed light and speak out regarding this outbreak, and we are expecting an update from officials from the county on Monday. For now, in Bakersfield, Leslie Gooden, 23 ABC News, connecting you.